What are the symptoms of Addison's disease? Addison's disease mainly presents with number one, severe fatigue, weakness. So if a person is having a lot of weakness, this could be one of the symptoms, especially if it is associated with frequent low BP episodes. A person who's having continuously low BP and having fainting because of low BP and having extreme fatigue, we must think of Addison's disease as one of the possible causes. The other common symptom that people talk about Addison's disease is a lot of gastric issue. They will have a lot of nausea, they might vomit frequently along with having weakness and having low BP as well. Please suspect Addison's disease in those cases. Not in pituitary cases, but in those cases which are affecting the adrenal glands, the skin color also starts becoming very dark. So people start becoming darker in color, especially if they are having hurt somewhere, their scars will start becoming darker and blacker in color. So if that is also happening, we must think about Addison's disease, one of the possible causes. So a person who is becoming weak, is losing weight, is having low BP, is having frequent nausea, vomiting, and especially if his scars etc. are becoming dark in color, we suspect Addison's disease. Now, how to treat this Addison's disease? It is the same as in all endocrinology illnesses. If a particular hormone is not being produced properly in the body, we have to supplement it from outside. Just like how we give thyroid supplements for hypothyroidism, testosterone supplementation for sex problems or hypogonadism, we do have to give cortisol supplementation in these cases. There are 2 or 3 ways of giving this cortisol supplementation. One of them is not a natural way but a cheaper way of giving, and we do replace cortisol. Replacement of cortisol can cause dramatic improvement in Addison's disease symptoms, and patients usually resolve very quickly. So if you are having any of these symptoms or you have been diagnosed with Addison's disease, it's important to meet up with an endocrinologist, a person who is trained for so many years in managing Addison's disease. So please consult an endocrinologist if you have been diagnosed with Addison's disease or have any of these symptoms that we have just spoken about.